Dr Girish Tyagi, President Delhi Medical Association. Yeah, National Medical Commission, why it came into existence? Because of the about the observation of the Medical Council of India from various quarters, from the even the Supreme Court, High Court has their reservations about the functioning of the Medical Council of India. The corruption cases were against the individuals of the Medical Council of India. Because of that, National Medical Commission came into existence. Previous government under the when the Mr. J.P. Nadda was the health minister, he bring about the National Medical Commission bill in the Parliament. But of course, it was referred to the select committee. Then the new government under the second Modi government came into existence with Dr. Harshvardhan as the health minister. He bring about the National Medical Commission bill, which of course has been passed by the Lok Sabha, Rajya Sabha, and the President accent has been taken for that matter. Composition initially, when Dr. Harshvardhan presented the bill in the Lok Sabha, it was about the 25-member commission. Then of course, with the lot of deliberation, amendment was passed, and the membership has been raised to 33. The good point is that in the Medical Council of India versus National Medical Commission. In the Medical Council of India, there was the same list of members were continuing the Medical Council of India for say last 10 to 15 years or 20 years. The same members were repeating. Now the National Medical Commission, only the maximum term is 4 years, maximum age is 70 years. There can be no reappointment, no extension, and of course the best thing is that you have to declare your financial assets and liabilities before joining and after remitting the office also. That is the good thing. And if one member is consecutively not attending the meeting for three meetings are not attended by the member, then of course he can be debarred from National Medical Commission also. Yeah, bridge course. When J.P. Nadda ji presented in the last government presented in the Lok Sabha about the National Medical Commission bill, there was a provision that bridge course for the Ayush, that means BAMS, BUMS, BHMS persons, for there was a bridge course that after doing the bridge course they can prescribe the allopathic medicine. But after the Indian Medical Association and different medical associations protested, when Dr. Harshvardhan presented this in the Lok Sabha, there is no bridge course. Of course, no bridge course for Ayush people, but mid-level practitioner is a word used that they will prescribe the medicines. There is a selected list of medicines they can prescribe in the primary health center or at the remote center. And Delhi Medical Association and various medical associations protested for that matter, that these nurse practitioners or whatever the name may be, they cannot and they should not be allowed to prescribe the medicines beyond the list. And one more thing we are demanding from the government, that whosoever the mid-level practitioner, whatever the terminology they can use, they cannot use the doctor before the name. That means they cannot prefix the doctor before the name, because if they use the name doctor before the name, that will amount to the quackery. So one thing is there. Plus one more thing is there in the bridge course, that in this when the Medical Council of India Act was there, in which there is a provision of, if the person is not qualified and prescribing the allopathic medicine, there is a provision of 1 year imprisonment and 1,000 rupees of fine only. Now, in this National Medical Commission bill, if the person unauthorizedly practicing the allopathic system of medicine, there is a provision of 1 year imprisonment plus 5 lakh rupees of fine. That means that this 5 lakh rupees of fine will be a deterrent factor to unauthorized practitioner to practice allopathic medicines. Yeah, entrance exam, because previously the whole this national eligibility entrance test will be there, that is NEET, in which all the institutions of the India throughout, including the AIIMS, PGI and other autonomous institutions also have to be, they don't have to conduct their separate exam, only the NEET exam which will be conducted, and based on that exam all the medical graduates will be selected based on that. Previously, because there were multiple exams, students have to go at different places. Sometimes there is a clashing of dates also, that two exams are on the same day. Then these NEET exam will be of that kind. Plus, there is a mushrooming of the coaching institute because of that at different centers. So that will be also be prohibited for that matter. And that is a good step, that at least based on the merit of the NEET exam, person if he is getting a good mark, then he can opt whether to go to AIMS or Chandigarh or Maulana Medical College or King George Medical College at Lucknow. He will be going to that medical college based on his preference and based on the mark sheet. Actually, basically the quacks are there in Delhi and of course in when I'm saying in Delhi, that means in the remote area there will be situation will be much more bad as far as quackery is concerned. In the resettlement colonies, you go to any resettlement colony, say Mangolpuri, Jahangirpuri or Karawal Nagar in the northeast area, there is a mushrooming of the quacks. The quacks are there because of the multiple reasons, because there is no coordinated effort from various agencies, because one High Court guidelines are there to go against the quacks, in which the Delhi Medical Council take action against the quack person under section 27 of Delhi Medical Council Act, in which there is a provision of 3-year imprisonment with a 20,000 rupees of fine, and that is a cognizable and a non-bailable offence. But the thing is that once the case is filed, it takes years to finish that, because conviction is very less, because after it takes around 10 to 20 years. The cases which were filed in 2003 or 4 are coming now for the trial at the trial phase. So at the time, so most of the quacks, they changes their place or they are not traceable. So the police submit the closure report that non-traceable, and of course there is a no coordination among the various agencies. Various agencies means Delhi Police, Delhi Government, Delhi Medical Council, and other agencies who take action against the quacks. Plus, one system is there that to take action against the quack, there is some, when the case, Delhi Medical Council files the case in the court, in the inspection team which is being done by the concerned chief district medical officer, because the drugs are not seized, because to seize the drugs of a quack, it is a drug controller who can seize but drug controller is not the party of the raiding team or the inspection team of the quack. So most of the time it is seen that the conviction against the quack is difficult, because the seizure of the medicine is not there. So around, of course, in 2006, Delhi government do a survey of the various colonies about the quacks, but it has not been published, and the report about how many quacks are there is not practically, we don't have. But in the figure from the media, from the newspaper, etc., it is presumed that 20 to 30,000 quacks are still practicing in Delhi.